Here at the Sinus Center at the Northern Lights Clinic, one of the critical things we do when we evaluate patients is a nasal endoscopy. And today we're in the endoscopy suite, and I'm going to be performing an endoscopy so that you can see what I see and what our patients see on the screen on the television here. Are you ready?
Ready.
Okay. With nasal endoscopy, I use a rigid nasal endoscope, and it's inserted in the nasal passages. And what this allows me to do is to evaluate the structure of the nose and the anatomy of the nose, and look at the nasal septum and turbinates. I can look for a septal deviation or enlarged turbinates. It also would allow us to see a tumor or mass inside of the nose, and to evaluate people for nasal polyps. In addition to looking at the structure of the nose, it allows us to look at the lining of the nose and see if the lining of the nose has any evidence of changes that we would see in people who had allergies or chronic infection. It allows us to look at the openings for the sinus cavities to see if they look blocked or obstructed, as well as to look for evidence of infection and pus draining from the sinus cavities. Typically, this is something we're able to perform under topical anesthesia here in the office. It's usually quite well tolerated by patients. It gives us a lot of information about what's going on inside of the nose that not all physicians have the benefit of being able to see. Good job.